The idea for Glocal actually generated from a personal tragedy. I lost my father to an unnecessary surgery in a very expensive hospital in India. And then we realized the healthcare system is broken. And this Glocal is an attempt to solve this problem, to make healthcare affordable, accessible and accountable by using technology and process-driven systems. So affordable, when we focus on affordable, we mean a cost that the country and the community can afford. So as an example, healthcare in US also is not affordable. Yeah, everybody should get access to healthcare, quality healthcare. And by accountable, we mean what you are doing, what you are delivering, there must be a reason to it, and there must be a measurement of the outcomes in healthcare. It cannot be unaccountable. So you must measure what you're delivering, what is the impact on people and on societies. Now, how do you do that is by using technology to remove barriers of space. So for example, telemedicine will bridge the gap between a doctor sitting in an urban area to a person living in a rural area. It will bridging the skill gaps by using clinical decision support systems so that doctors can perform better, nurses can perform better. By reducing costs by automation, when you automate things and you make the results come out very quickly and medicines to be supplied efficiently, you reduce costs. By accountability, by being able to diagnose correctly and managing correctly. So when you use point of care technologies to give test results to the doctor when he's writing the prescription, not one day later, you are improving the efficiency and outcomes. By using the clinical decision support system, you're helping the doctor to make the right decision, to calculate the right dosages, to prevent contraindications and drug interactions. Spectrum of technology begins from one end, from building technologies where you use pre-engineered steel and glass to be able to set up hospitals very fast and quick, from what we call lean healthcare systems or zero-based designs to build buildings much more efficient so that the traffic flows are more efficient. Then telemedicine, we use WebRTC for telemedicine, we use point-of-care technologies for instant diagnosis, we use Internet of Things for being able to transmit medical data to a doctor sitting remotely. And finally, our semantic algorithm-based artificial intelligence, which is the brain behind everything, that allows the right diagnosis to be made and the right decisions for management being made. So it's a complete end-to-end suite of technologies which we call Hello Life and Litmus suite of technologies that ensure highly efficient healthcare.
What are the current African countries are you involved in with?
Right now we are involved with DRC, the Democratic Republic of Congo, Ivory Coast, Tanzania, Nigeria, Ghana, Namibia, and hopefully we will be closing one deal with Kenya, and we're looking forward to working with all the African nations.
How do you describe your experience in those countries so far?
So first of all, I'll say that we are very committed to our African story because we believe Africa is as huge as China or India. So there is some amount of political uncertainty in some areas in Africa. However, having said that, I think for healthcare, we will learn to solve these issues and work with everybody because irrespective of political equations in a country and stability, everybody needs healthcare. And we can probably make it work in every area. So it's going to be a challenging experience. It's not going to be extremely easy. Healthcare is a lifelong commitment and passion. So when we're entering, we are committing ourselves to the next 30 years to be a partner of Africa. So we will enjoy the journey together, the challenges, the difficulties, the nuances. It's a rich, very diverse, a very complex piece of place, and we love and we want to be